Three simple letters that hold so much meaning, devastation, and peace. A DNR, or a do not resuscitate order, is an order written by a physician that states under no circumstance will a patient receive cardiopulmonary resuscitation or CPR. First created in 1976, DNRs have become widely used in hospitals around the world as it gives patients control over their end-of-life care. DNRs are typically set up before an emergency, but can be implemented after a medical emergency. However, in recent years, there has been a divide in the community, a divide between those who support DNRs and those who don't. To see this divide is Dr. Ashley Shaw, the head of medicine and trauma surgery at Harvard. All right, thank you guys. Let me know if you have any more questions. Oh my gosh, hi, are you here for the interview? All right, let's go to my office. Hi, my name is Dr. Ashley Shaw, and I'm a trauma surgeon as well as the head of medicine here at Harvard Medical Center. Throughout my many years, I've lost many patients, but I've also seen a lot more. DNRs play a vital role in my day-to-day life as I'm not only educating patients, but I'm actually signing DNR orders for my patients.
Excellent, thank you. So the whole reason for being here today is the divide of the anti-DNR people and the pro-DNR people. So do you have any pros and cons you could give us?
Yes, I do. So there is a lot of pros and a couple of cons, but the big one overall is that you could decide on your treatment beforehand. So let's say you have a chronic or terminal patient, they come in, they're kind of able to take more control over their end of life versus someone who was caught in a car accident. The other thing is family members. Lots of times we'll see young children having to make decisions for their family members. That causes a lot of trauma, and they're already going through the trauma of watching their family member in this traumatic event as well as maybe passing away. DNRs can also be modified. So let's say you get a DNR and you don't like it, you can change it so that you can only be resuscitated once or twice, or you can completely revoke it. And that's the other good thing about DNRs is that you can revoke it. A couple of cons, people have said that they've been discriminated against for their DNR. Doctors have not treated them or treated them differently, and there has been some areas of neglect, but that's only been a couple of rare cases. DNRs are also often not discussed early enough, so you often hear DNRs being discussed when the patient is in the hospital, never before. With elderly patients, we do see some talk about advanced directives before, but it isn't unless like something happened in their past that caused them to really focus on advanced DNRs. And then another thing is the lack of understanding, because patients think that the doctors are going to discriminate them. They don't want a DNR, and then they tell their friends that the doctor's going to discriminate, and then it's just a huge snowball rolling down a hill from there.
Great, thank you. We'll keep in touch.
Okay. Dr. Shaw has given us a lot of information, but information can only get us so far. Real-world experience might help us to understand why patients have negative feelings towards DNRs in the first place. To get to the bottom of this, we'll be visiting Cade Holland. Cade is a freshman at Texas Tech. He's a chemical engineer with a minor in computer science. However, Cade is not only balancing 18 hours of schoolwork, but end-stage thyroid cancer. Cade was given the choice to get a DNR after a series of impressive seizures that left him in the hospital, but he said no. Good morning, Cade.
Good morning.
So can you tell us a little bit about your story?
Yeah, so I found out about my cancer about a year and a half ago when I had a grand mal seizure at my school. I was taken to the hospital and they did an MRI which found the mass. I had some pain in my neck prior, but I always thought it was caused by allergies or sleeping wrong. I started chemo about a week after my diagnosis and discovered mets in my lymph nodes. I decided to make the most of it, however, and to follow my dreams. That is how I ended up here at Tech. I'm not letting my diagnosis take anything away from me.
That is a truly amazing story. Thank you.
Of course.
Now, I do have some questions for you. We're here today to talk about DNRs. You don't have one, correct?
Yes, I don't have a DNR, nor do I want one.
Okay, would you mind sharing your reason for that?
Well, there are many reasons, I guess. When I was little, my mother was in a car accident and was placed on life support. Since I was the next family in line, the doctors gave me a choice to get my mother a DNR. They told me that there was only a small chance that she would wake up. I decided to go ahead with the DNR, and one thing led to another, and she passed away. My issue is that I felt that the doctors stopped treating her after I approved a DNR, and sometimes I wonder if she would have woken up if I hadn't gone through with it. But I was a kid and under a lot of pressure, so I will never make the same mistake again.
Thank you, Cade. I was wondering if you could elaborate further on how you felt that the doctors stopped treating her.
They wouldn't check up on her as often, and they moved this big cart with all these medical supplies out of the room. I felt like they were signing it because she became invisible.
It sounds like that big cart you saw was a crash cart. A crash cart contains various supplies to help a patient in a medical emergency. These can be items like a defibrillator, medications like epinephrine and atropine, syringes, intubation items like Mac and Miller blades, stylets, and bamboo bags. The doctors most likely removed the cart to ensure that the defibrillator was not used on your mother.
But I thought that DNRs meant they could not do chest compressions.
That's actually a misconception. DNRs cover CPR, which includes defibrillation as well as chest compressions. DNRs don't cover any intubation or other life-saving measures like an NG tube.
Oh, but what about them not checking up on her as much as before?
To be honest, that could be a number of things. Doctors prioritize patients using various criteria. Your mother was high on the list when she came in, most likely because she was unstable. I don't necessarily think the physician ignored her because of the DNR. I think that she was stable enough that the physician felt comfortable leaving her alone for longer stretches of time.
Okay, but then why was I asked about my mom getting a DNR? Why not someone else in the family?
When it comes to medical proxies, there's a list of steps to follow to determine who gets to make the decisions. The first person in line is usually the spouse, then followed by the child, and if a child's not available, then the parent of the patient. You were most likely chosen because your father was not around to make that decision.
Oh.
That is why our goal with this documentary is to spread awareness. Children having to make decisions regarding their parents' care can cause a lot of stress, and it's a traumatic event that follows them throughout their lives. By spreading awareness, we can help lower the chance of a child having to make that decision.
So people usually don't have these issues?
I wouldn't say that people don't have these issues, but I will say that they are uncommon. Children might have to make the decision, but it's very rare for a physician to treat their patient differently because of a DNR. DNRs simply mean that we won't perform CPR on the patient. We'll treat them the same as every other patient except for that one task.
Oh, I guess I never looked at DNRs that way.
So knowing what you know now, would you consider getting one?
I have to think about it, but I am more open to the idea now. Thank you.
No, thank you. After our initial interview, we tried to keep in touch with Cade. However, he unfortunately passed away on April 5th, 2023, at home in his bed surrounded by loved ones. After our conversation, Cade did get a DNR, but was sent home on hospice. Cade's family has since started the Holland Foundation in order to inform more people about DNRs and to provide support to young adults facing terminal illnesses.